Mark Korson. Good morning. I am Mark Korson, a founding board member of Rare New England. Speaking this morning from my location in rural Quebec into the audience void, I'm reminded by what silent film star Norma Desmond said in the hit Broadway play Sunset Boulevard. She would get into her zone and reminisce. It was just us and the cameras and all those wonderful people out there in the dark. All right, Mr. DeMille, I'm ready for my close-up. Well, hello, R&E fans out there this morning. It's good to know you are with us. Working in the health professions is not for the weak or the faint of heart. Engaging patients and families who are fearful or curious or traumatized or burdened is rewarding. We have the opportunity, the privilege of participating in the drama of people's lives, offering assistance and support and guidance. But it can be hard, demanding, sometimes relentless. And couple that with the difficulty in working in a rather rigid, often unsupportive healthcare system, well, health professionals can be worn down, they can burn out. Add to that a viral pandemic, and you have to wonder, what exactly keeps providers going? Today's panel is talking about health professional resilience. Okay, Mr. DeMille, we are ready for our close-ups. We have with us 3 providers in different capacities. We will hear from each of them and then take your questions, so please write your questions and I'll pose them at the end. Let me introduce my first speaker. Dr. Amy Kritzer is an attending physician in the Division of Genetics and Genomics at Boston Children's Hospital. She graduated from the Albert Einstein College of Medicine in the Bronx. She did her pediatric residency at the Floating Hospital for Children at Tufts Medical Center in Boston, and then completed fellowships in clinical genetics and medical biochemical genetics at Boston Children's. Her clinical work is focused on the care of children and adults with rare and metabolic conditions. She serves as physician lead for quality improvement in the Division of Genetics. As such, she creates and implements patient care initiatives designed to improve patient safety and patient and family experience. Her work is dedicated to addressing the psychosocial needs of patients with rare diseases. Amy.
Thank you so much, Mark, for the introduction and for allowing me to come and participate in this wonderful conference. I think it's always wonderful when we can all share our experiences. You know, when the pandemic started, I had already been balancing working remotely and working in a hospital. And so I was actually uniquely ready to take on some of these changes. But all of a sudden, you know, we went from being in our work zone to being in our work and family zone all at once. And while that eliminated commuting, which I loved, it also meant that we were kind of walking a tightrope all the time in terms of balancing family needs and patient family needs. What I started to see was that, you know, while the world was trying to figure out what was going on, we were trying to figure out for our patients, how do we care for them when hospitals and healthcare systems are limiting access, where the things that we took for granted, being able to send someone to a lab to get lab work done, got harder. And I think what we all came together of and what really kept us going was just that we were in it together. And the number of emails that I got that clearly showed how challenged both, you know, providers and patients and families felt. We kind of felt like we were figuring it out together. And it equalized, you know, the playing field for a lot of people. One thing that I found really interesting was that I was hearing from a lot of my patients that for the first time they felt seen. They had spent, you know, years, weeks, decades trying to keep their family safe from illness, trying to prevent hospitalization. And often people around them didn't really understand that. And all of a sudden, everyone was in that boat of trying to figure out what was safe to do, who could we get together with, how do we avoid illness for our families. And they said for the first time, people seemed to get it. They understood that this wasn't an overprotection, this was what you needed to do to stay safe. And all of a sudden, all of us were in that situation. I think what I found really wonderful was how we were able to adapt and connect with our colleagues over Zoom, how we learned that a lot of what we needed to do, we needed that FaceTime. We needed to be able to see people. We needed to be able to see our little ones, our kids, and I've missed squishing little people so much because you can't squish people over Zoom. But I think what we really found we needed to continue to be able to do our jobs well were to stay connected. So that translated to a lot more Zooms, Zoom coffee hours, Zoom happy hours, Zoom meetings. And that really was important for all of us to be able to continue to feel connected to our colleagues and to our families. I think one of the best things that came out of, or the silver lining for me that came out of the pandemic, was the advancement of telehealth. And for me, it gave me for the first time a snapshot into people's lives in a much more functional way. I could see kids playing in their playrooms. I could see development. I could talk to patients who had been too scared or too anxious to talk to me previously. And so that was just a really amazing opportunity to feel like I could actually be part of their experience that way. And so I think, we looked at what was, initially supposed to be a brief change in how we worked, which obviously became a much longer change in how we worked. And really, as someone who works on improvement projects, really tried to say, how do we do this better? We have an opportunity to redefine how we care for people, and what are the types of things that we want to continue? What are the ways that we can continue to stay connected? I think for those of us balancing work and family, I think it also helps our patients to know that we were in the same boat as they were. We were trying to school our kids. We were trying to, keep some kind of schedule, some kind of regularity for everyone in our lives. And I think it really made people feel like we were, I was in this with them, and I certainly felt that myself. I think for a lot of people who work in healthcare, this has been a tough couple of years. I think with everybody, this has been a tough couple of years. And I think the idea that we can continue to help and to continue to provide that same level of compassion and kindness over a computer screen rather than in person was very helpful. My family will tell you that I am the happiest on my clinical days, and I am the grumpiest on my administrative days. So my ability to stay connected to my patients, my ability to get them in, for an urgent telehealth visit has really been wonderful. We were able to make that eye contact, have that relationship. And that's been really, I think, one of the things that has continued to make me resilient during this time. I think that we are now in a really interesting transition of trying to figure out how to do almost a hybrid model of in-person care with telehealth care, which appointments can be done which way, and how, I think, do we get people back for needed assessments like labs and imaging, because a lot of that went by the wayside. And I think everyone has had that experience of having a pushback in any healthcare that they've needed because of limitations. I think it's helping us to be more organized. We are learning we need better systems for tracking patients, for tracking results, for testing. And that's really been helpful to realize how easy it is for things to fall through the cracks, and what types of systems do we need personally for our own patient population, but also for our clinics and our larger patient groups. And I think that's been something that has really been one of those challenges that we've been addressing, and I've been trying to address through some of our quality work, is how do we add that extra level of support that we always knew families needed. Now we're just able to see it a lot clearer. And I think that that's one of the things that I've really seen jump to the forefront, is that we need better systems. We need systems that don't rely on one person. And I think that that's something that's hopefully we will be able to continue to work on as we come back to this hybrid model of healthcare. I think for me personally, this has been a very unusual time. Again, as a mother, as a wife, as a daughter, a sister, I have been managing questions from friends and families and patients, and trying to make sure that we are always also providing the best information with what we know. And obviously in rare disease, that's often, there's a lot of unanswered questions. And so we're able to, I hope, be able to provide some level of guidance through, what is out there, to understand the safety of all the new medications and the vaccines that have come, which have been very helpful for our patient population. I'm happy if there's questions specific people have, I'm happy to answer those too.
Thank you so much, Dr. Kritzer. I think what we'll do is we'll hold the questions till the end, and let's go on to our next speaker. Brittany Holmes is a nurse practitioner at Yale University Department of Genetics. She sees a wide variety of patients with rare diseases at Yale New Haven Hospital and specializes in inborn errors of metabolism. She also participates in research projects through Yale for patients with metabolic conditions. She received her Bachelor of Science at Merrimack College and Master of Science in Nursing from Simmons University in Boston. Her interest in working with inborn errors began at a young age due to her personal experience as a patient with a rare disorder, PKU. She spoke at conferences from the patient perspective, which ultimately led to her seeking a career as a healthcare professional in this specialty. She enjoys being able to offer both the provider and patient perspective, and has a passion for caring for patients with this specialty. Brittany, you are muted. Thank you for being here.
Hi, thank you so much. So I do have some slides. I'll share my screen. They're nothing crazy. It was more just so you all had something to look at other than just me. And so I have some bullet points here. So Amy did a great job at kind of an overview of everything, and I agree with so much of what she said. So I'm just going to go right into a little bit of our challenges that we faced. I'm sure there's a lot of overlap in other clinics as well, but also some of the positives that we saw, and then next steps for what can we do about overcoming some of the challenges that we haven't overcome yet. So, one of the big things that's kind of almost like the obvious for us was caring for a vulnerable population. So obviously at baseline, having a rare disorder leads to other challenges. So add a pandemic and this is difficult. But then increased difficulty and access to resources was really hard for a lot of our patients. For example, I had a patient that they really needed this service that was like intensive family services, which usually goes into the home, which could not happen during the pandemic. And unfortunately, the virtual piece was still helpful, but not as helpful as being able to really assess them in their home. So that was something that we noticed, and just access to some like patient assistance programs, because things are all backed up. That was more difficult. Increased fear of illness and hospital admissions for the patients that are at the greater risk of serious illness from COVID. A lot of our families had a lot of anxiety about this. And then increase in social isolation, of course, because, everyone is needing to be isolated during the pandemic, but for someone with a rare disorder who maybe feels isolated already and then can't even go see the people that they usually like to see, then, that's also more difficult. And feelings of anxiety and depression as well. So with rare disorders, there are studies that show that some patients might have a higher rates of anxiety and depression at baseline, just because obviously there's challenges that come with having a rare disorder. And then during this pandemic, the general population even had an increase in anxiety and depression. So add that with our patients with rare disorders, and obviously we were seeing a lot of anxiety for sure, and issues like that. Financial struggles, some patients that already had that, the pandemic did not help. That added more barriers, especially if people were getting laid off or things like that. And difficulty accessing mental health services. And this has been a big issue, not even just for rare disorders, because obviously, like I said, the general population has seen an increase as well, but for our rare disorders too, this has increased unfortunately, the mental health services are just overwhelmed right now. So it's been really hard for everyone. And issues receiving education and therapy services. So education-wise, for example, we've had unfortunately some school systems that have not been following the CDC guidelines for back to school, whether it's because of pressure from the Unmask Our Children groups or things like that. So they were not following precautions. So a lot of our patients were nervous to go back to school and needed letters if they were high risk for illness. And obviously then they missed out on that in-person part. And getting the therapy services that they needed. So PT, OT, those kind of things, a lot of them went virtual. And we heard from a lot of families that the virtual services were just not the same. So a lot of their kids, they noticed just kind of like stalling in their progress during the pandemic because it just wasn't the same. Delays in shipping and medication back orders were a huge problem for us for a while. I'm not sure if other people experience this too, but I know I had multiple medications like hydroxycobalamin was one, B12 for some of our patients, formula, all these things that had back orders or just because of shipping delays during the pandemic. So this obviously was a big stressor, especially for patients that really didn't have another treatment option and their one treatment was on back order for months. And then, of course, as Amy mentioned, difficulty obtaining labs, that has been tricky. And then these are some challenges that are a little bit more from the provider side. So staffing difficulties have been an issue in a lot of places during the pandemic and now. And then this increase in patient calls and messages. This has, these are all very valid. I never mind patients reaching out, but obviously because of if you see above the staffing difficulties, this created challenges for us. There were, there's a lot of questions and still are regarding COVID and vaccine questions, which again, all very valid questions, but we also seem to have an increase in just general questions. I'm not sure if it's just because like people are home more during the pandemic and have more time to reach out and, have these questions that they realize they've been putting off for a while. And now they're like, oh, I'm going to get this stuff done. So we've just been inundated with messages daily from patients, which again, I'm always happy to talk to patients and I'm glad patients are reaching out to get their questions answered. But obviously when there's staffing issues or not enough support, that can be difficult. And in addition to just the staffing issues, there just has been, a difficulty finding enough support for preventing provider burnout. Obviously, patients need to be seen. We can't just be like, oh, well, the day is done when, a patient needs help. So there's a lot of providers working, a lot of extra hours. And that's obviously causing stress on healthcare as well. And then delay in research and clinical trials has been a big issue. I know there's some that we wanted to be involved in that have been delayed. And obviously in the rare disease field, this is tough because we need these, we need more therapies and options and research. And difficulty fundraising. So I know from the perspective, I'm on the National PKU Alliance board, and just a lot of these nonprofits saw some difficulty with fundraising, especially if they relied on these big in-person events for fundraising. So that was something that was tough. But now on to positives. As Amy also mentioned, telehealth has been really a big positive in my viewpoint. It's really increased access for patients that might live far or have a hard time leaving the house, and allows us, like Amy also mentioned, for more frequent follow-up. So if I, typically might have seen a patient back in 6 months, for example, because it was going to be far for them, I could say, well, we can see you back in person at this time, but then let's do a check-in, a few months in between. So we really get to see them more frequently, and it really helps with compliance and just patients really staying on track. And being able to see patients in their homes, Amy also mentioned this, in their own environment, or if, there's something like a medication that they had a question about, they're like, oh, I have it right here, I can just go get it and show you. So that has been helpful. And more flexibility in the schedule is huge. So for us, we share, the patient exam rooms with the pediatric specialties. So in order for me to see a patient, I have to make sure there's a room available and all of that. But for me to see a telehealth patient, all I have to know is my schedule and the patient's schedule, and I can put them in wherever. So that has been huge too. And then reevaluation of workflows. Ways to increase efficiency has really been pushed because we've seen, such an influx of things, and we're really trying to figure out a better way to do everything to be the most efficient as possible while still, providing high quality care. And the pandemic really kind of forced us to do this. Just like with telehealth, our clinic actually didn't have any telehealth before the pandemic. It was something they were working on, but the pandemic made, really forced them to push it out fast. So that has been some things that have been helpful. And the hybrid models, clinicians being able to have some ability to work from home has been helpful for productivity and just trying to help with that work-life balance a little bit. And switching to electronic capabilities. So things like, electronic faxing had to be switched to, because if we're working from home, we can't get a fax that's in the office. And those things I think seem to help, because you would, decrease room for errors and things like that. But obviously we haven't solved everything. So this is kind of my last piece here, just additional steps for overcoming challenges. So I think social work support is going to be huge for patients. I know our social worker has been really, really crucial, and not every clinic has this. So increasing social work support for patients. Preventing provider burnout is going to be really important to find ways to do that. And ensuring adequate mental health evaluations, which I know is a struggle for everyone right now. Trying to, now that we know that things can happen with all these back orders and things, making sure that we have backup plans and better emergency preparedness, I think would be really helpful. And I think continuing both these in-person and telehealth options for patients will be really beneficial. So that is definitely a good thing that's come out of the pandemic, but I think being able to continue that going forward, but also continuing to improve the telehealth services that we have. So keep making sure more patients have access and that it's easier for them. And that's really the main things that I had. Let me stop sharing my screen so everyone can see each other again.
Thank you, Brittany. Our third speaker is Mary Frances Garber, who I've known for forever, since the last millennium, actually. She is a board-certified licensed genetic counselor with a private practice, Listening, Reflecting, Healing, where she provides supportive genetic counseling and bereavement services. Her belief is that individuals and families need a place to process their emotions associated with their genetic issues. In addition to this, Ms. Garber works as a per diem prenatal genetic counselor in the maternal fetal medicine department at Newton Wellesley Hospital and as a consultant with Genome Medical. She was the executive director for NERG Incorporated, the New England Regional Genetics Group, for 11 years. Earlier in her career, she worked at Brigham and Women's Hospital in the Antenatal Diagnostic Center. She attended the University of Rochester, graduating with a BS in molecular genetics, and Sarah Lawrence College, where she earned an MS in human genetics. Mary Frances is a member of the National Society of Genetic Counselors and has served as regional representative on the board of directors. She previously served on the Boston University Genetic Counseling Program Advisory Board. Good morning. Thank you for being with us. You are muted.
Thank you, Mark, for the introduction and for telling everybody that we've known each other for a very, very long time. I thank you, Julie, for inviting me to be on the panel today and to interact with providers and family members and those who have an interest in rare disease. It seems like yesterday that I started out as a genetic counselor, but it was actually over 3 decades ago. I never thought I'd be that experienced counselor speaking about having to navigate a pandemic and how to figure out how to best care for our practices, our patients. So I have been a genetic counselor for 3 decades, and I was trained at a time that when we graduated, we either were going to be a prenatal counselor or a pediatric counselor in a hospital, period. There was no cancer genetics, there was no industry to work for, and there certainly wasn't private practice like what I'm doing now. And so I've been able to see the profession evolve and to see how we can adapt to taking care of our patients with telehealth. I never dreamed that I would be seeing all of my patients on a screen like this, alone and in my home. But we have adapted and we are doing that now. So prior to March 13th, 2020, I was a per diem counselor at Newton Wellesley Hospital. I am no longer doing that. I had my private practice and I was a consultant for Genome Medical, which is a telehealth genetic counseling service. I didn't think that when I walked out of the hospital on March 11th, that I wasn't going to get dressed and get in my car and go back. I don't do that anymore. And so I have a loss of patient contact and contact with my colleagues. Similarly, in my private practice, I don't see my patients in person in the office down the street anymore. I'm meeting with them via telehealth as well. And so instantaneously, this girl who loves to talk was, put into this isolated environment and living with a screen and technology, and at first at my kitchen table. I'm fortunate that we could, after 6 months of doing that, adapt and create this beautiful office for myself and another space for my husband, so that we could both be having private space and comfortable while we work from home. I agree with everything that Amy and Brittany spoke about and outlined, the challenges, the benefits, and some of the ways that we have adapted. As genetic counselors and medical geneticists, we have relied on our physical contact with our patients and with each other. Our work is emotional, and as a genetic counselor, I have relied on being present with my patients in close physical proximity with them. When you have to give a hug, when you have to give a tissue, whatever that is. And as medical geneticists, we've relied on the physical exam. Yes, historically, genetic diagnoses were made by looking at our patients, not with, a saliva test and gene sequencing. But even with telehealth, I know that we've adapted to that. And I was lucky enough to participate in a New England Regional Genetics Network telehealth training program, which even included how do we ask our patients to show us things so that we can see physical findings. And so now I'm comfortable asking people to show me their chest. Is there a pectus? Show me some hypermobility, show me your skin, and things like that. And so we have that resiliency, and we have adapted to do some of that. I'm thankful that personally I was working with telehealth before this started, because, you get set in your ways when you've done something for a long time. And if I hadn't had my years with Genome Medical and seeing patients online, I think I really would have sunk and not done so well. But that job, that consultancy, and seeing so many patients that way, and the training gave me the confidence to do what we're doing now. Talking a little bit about work as a genetic counselor. I mean, genetics counselor, it's, the science and then the psychosocial issues. And so I thought I would talk a little bit about that. And that, our work is really emotional. We deal with grief, guilt, loss, bereavement, and many of us are used to collaborating with our colleagues, having the curbside consult with colleagues and debriefing emotionally after seeing a patient or a family that is really struggling, needing to process that. Maybe discussing family history or a differential diagnosis, or do you think I should offer that test? And so instead of doing that on the hallway with my colleagues, now I'm faced with having to draft a long email. And for those of you who've worked with me, I don't like to type long emails. I want to talk on the phone. So sometimes I get to do that, but just missing that contact and talking with colleagues about patients. Some days are harder than others, depending on the patient load, depending on what I encounter with people. And so needing that contact with colleagues and with patients off screen, craving for that, wanting to draw a pedigree by hand and not with the technology and the platform that I have to use. How do I put something there without having to figure out how to do it? Missing that. I talked a little bit about being lucky enough to set this up, setting up online payment for my private practice, having the existing referral base that I have from the medical centers and my colleagues in the greater Boston area. Having all of that in place, I'm thankful for, because I think starting that with COVID would have been a very, very big challenge. Missing the contact of in-person meetings, NERG, the wine, talking there with people. We haven't had that. Look at all of our names on the screen here today. You know, this is different. Needing supervision. You know, genetic counselors really like to have genetic counseling supervision, running a case by our colleagues and hearing how others might have handled that. Me wanting to start that for my colleagues online. But the bottom line is my role is with my patients, whether it's at Genome Medical or private practice, and really just being present for them, listening to them about pregnancy loss, about anticipating the loss of their child with a life-limiting illness or an adult with genetic issues, and sitting there with them. Again, missing that contact. So I think I want to talk just for a few minutes about less about us as providers and me, and more about the patients. We've touched a little bit about this, the ease of scheduling appointments for them. There's no travel. There's no time restriction. They don't even need daycare. Their kids can be over there playing with the blocks while I'm meeting with the bereaved couple. Increase in attendance in support groups. I'm a consultant for Mass Down Syndrome Congress, and I run about 6 different groups. In person, there were 4 attendees. On Zoom, there's like 10. I can do it at night if they need that, you know, whatever. Quick turnaround time for me to get back to my patients. I'm always on my computer. Like, it's just always open. So the email comes in and I can book a visit or talk to a colleague about a referral. I'm thankful for Genome Medical because I do have a team that I work with. I have collaboration, I have support there, and I have that in-person contact, although it's across the miles. I'm also thankful that not all of our states have licensure for genetic counselors. So my practice has broadened. I get referrals from Florida and Colorado and Vermont, and I can see people struggling there with genetic issues and provide ongoing supportive counseling for months or a year, whatever is needed. So, you know, this pandemic of 2020 is different from the one in 1918 that my grandmother lived through, but lost her sister in. There are similarities if you look at the footage and the photos, but there are differences. And there are differences that we live with in our work environment. But through telehealth and figuring out what's best for our patients, we've been able to adapt and have increased accessibility, and we've been resilient. And so those are my thoughts about the topic at hand today.
Thank you very much, Mary Frances. So please, if you have any questions, please write them in the chat box. I'll pose those questions. I'm not going to pose these questions specifically to anybody, but really leave it open for the group. And if speakers, if you have something you'd like to share, please do so. One question. What are some of the lasting impacts you think the pandemic will have on the healthcare system and patient care?
I think hopefully telehealth, and I think we've seen the expansion of telehealth. I agree very much with Brittany that one of the wonderful things has been this ability to connect with people more frequently, where, you know, distance to clinic used to be a huge issue. So that ability to do a 3-month check-in, a 1-month check-in, the ability to know that we're here when people need us. I think that is one of my big hopes is that telehealth is here to stay, particularly for longitudinal care for complex patients.
Yeah, I totally agree. I don't have a ton to add there because I think telehealth is like one of the biggest things, especially like I said, for us, because we didn't even have it yet before the pandemic. That's been huge for sure.
So you're having a difficult day in clinic. This is in the old times. This is pre-COVID. And you've just seen 3 patients and families, and you are exhausted. And you walk down the hall to your colleague's office, you close the door, and you sit down and you vent, or you cry, and that's gone now. It's not easy. What how have you changed? What has happened to your professional community in your work environment? And have you started making changes to somehow replace that doesn't exist as much? I mean,
Yeah, that's a really good question, because I know that was something difficult for us. And this took us a while to figure out, but we realized that after a while that was a big missing piece. And so we've tried to find ways, again, more virtual, but tried to find ways to be able to be all connected. So one, we would try to do Zoom meetings, kind of like debrief a week or two. We more recently started using Microsoft Teams. So we all have, group chats and things like that. So we really can just kind of like talk to each other in live time, and it's secure. So we can, if we have to talk about patients too, that's helpful. So I think that's helped us feel a little more connected when we're not physically in person. So that's been a help for us.
I think for me, I think, while it used to be you kind of walk down the hall and whoever was there, I think obviously we've had to kind of identify, okay, which of my colleagues is going to be my go-to, who is my support team, who can I call? So there's been a lot more quick text of like, you have time to chat today, or I want to run a case by you. And I think that while that takes a little more effort, what I've really come to realize is everybody has been there for each other. And so I know I have 4 or 5 colleagues that if I have a bad day, if I need to run something by, I need to vent, I need to discuss something, that I have my go-to people. And often that's been over telephone, just because then you can do it when you're driving or when you're with your Bluetooth, so you're not holding your phone, but while you're walking, while you're doing something else, and really taking those opportunities, those extra 5 minutes in the day to try to connect with people. But it does take effort. It's a very different way of connecting.
Mary Frances, how have you strengthened your professional connections?
Yeah, I think, relying on prior colleagues, classmates from grad school. I mean, there's always somebody that you can call. I think all of us feel that we have, whether it's the mentor, if I had to call you, Mark, I'd call you. I think we each have somebody that we can say, can you just listen to this right now? Or what do you think about this? But like Amy said, it takes more effort. I mean, I loved working on a hallway with a medical geneticist and other genetic counselors. And I really do miss that contact, because I don't have anybody here at all. So you really have to rely on making the effort and reaching out. And like I said, I think, genetic counseling supervision and having a support group online, one night a month is a really beneficial thing, and hope to get that started.
Good, thank you. Comments, comment and question. Can you imagine that within your department or division, that there might be a Zoom with doctors and patients together, like a social event? There had been some in person before at certain locations, but now we're in this situation. Maybe one over Zoom could help us feel more connected and help support us go back to, quote, normal.
So that doing events with patients have been one of my favorite things to do before the pandemic. And I think there was something about the in-person experience that I think was really special, particularly when there was space for the little ones to be playful and the adults to have time to talk. I definitely could see Zoom filling that void for adult patients and for parents. I think, obviously we needed consent often from people to have those visits. And so there's always those levels of complexity you'd have to work out. But I do think that it certainly is a great idea and could be utilized much better than what we're doing now, which is not being able to have any of those events.
I think providers participating more in disease-specific organizations' outdoor events, because a lot of the groups are still having some of their outdoor events, and that if we can, know that we have patients that are involved in those groups, attend those and show our support that way and interaction that way, that can be a very positive experience too.
Mm-hmm. Okay. So I remember back early on in COVID, I remember listening to the radio, NPR, and there was a national news broadcaster who was sort of doing his thing. And you heard in the background, "Daddy, Daddy," and he's trying to continue, "Daddy, Daddy, what's the password?" And you identified right there, the situation, you feel for the person. This experience has been a humanizing equalizer. But patients realize that providers are human. Does that, and not sort of up here all the time, does that take away any credibility, because you are just an ordinary human? What do you think?
I actually think being an ordinary human has always been something I've tried to do with patients. I'm very quick to tell people I'm a mom of 4. I don't mind the chaos. Kids being kids doesn't bother me. And I've been able to see kind of the relief in people's eyes of, okay, I don't have to worry that my kid is misbehaving right now. Or when I say I'm really overwhelmed with the day-to-day life, okay, she gets it. And so I think that's been something I think has obviously been more apparent during the pandemic, but I think it's really important to kind of share who you are with people you want trust from.
Mm-hmm. Okay. Do you have advice for patients on how to get the most out of their telehealth visits? How should they prepare? What should they convey? Should they approach those visits different than an in-person visit?
I would say for that, I think, one of the things that is helpful is try to make it as close to in-person as you can, in the sense that, we've had patients that have done it, like they get in their car and drive, and we're like, no, please don't drive while you're on the video chat. Like, try your best to, I know the benefit of virtual is obviously you can do it anywhere, but if you can at least be in a quiet room, like we had, another issue recently where someone was doing it in a grocery store. Obviously, we don't want to discuss your protected health information in public areas or somewhere that you can't, be a little more private, and so that it can be quiet, so that we can really, have a meaningful visit with you. So I would say, try to do your best to make it as close to in-person, in the sense of, trying to find quiet space to do it, and that would probably be what I would say was one of the biggest things for the telehealth visits.
Mm-hmm.
Yeah, I would agree with that. And I think also, if you think it's going to be hard for the child to sit through the whole visit, but you have a lot of questions as a parent that you want to really spend time on, try to have someone else that the child can be supervised for once they're kind of done with their part of the visit. Or if there's other people you want at the visit, I've had teachers join, I've had both parents join from different locations. It's really an opportunity to kind of get everybody to the table if that's something that you're interested in. But I think taking it seriously and not trying to just fit it in and get it done, but really looking at it, like Brittany said, as your opportunity, like an in-person visit, I think is really important.
Mm-hmm. And Mary Frances, does it alter counseling?
I think that I try to have people not in the car,
Mm-hmm.
because a lot of my patients are very emotional when we meet, and to have a quiet space in their home. But, I think people sometimes, when they're talking about the issues at hand, if they have a very sick child, holding the child while we're meeting sometimes is comforting to them. And that didn't always happen, in my private practice. People didn't tend to bring their child to the office. So I think that that's a benefit. I think having a partner be able to just come into the visit and leave if they have something else to do for part of the visit. Having a shared visit opportunity is nice as well. Maybe the woman needs a little bit more hand holding than the other partner. Their mother needs more hand holding than the other partner. And so that person might be present for the whole hour, and then the other person might just come in for half of the time. I think that's a nice thing too.
Mm-hmm. Isolation is always a problem for patients and families with rare diseases. What has been your experience through the last 18 months? What have you heard?
I can talk a little bit about that. I think for a lot of patients with rare disease in their home, they're very fearful of getting COVID because a lot of them are immunocompromised, and they're afraid for providers to come in to work with them or their children. They're worried to see family. I think the isolation, it has always been there for people with rare disease because they feel unique and they feel isolated within the disease community, if you will, or within the typical community, but now they're isolated because they're afraid of getting sick. And I think that sometimes that's been an emotional issue that I've had to deal with almost everybody in that situation.
Mhm.
So it's isolation on top of isolation, I think.
Yeah, I agree. I think a lot of families felt they had to make really tough decisions between services for their child, PCA support coming into the home versus an infection risk, and just the loss of all of those local supports was really, really challenging and exhausting.
So a couple of professionally related questions. If you're trying to assess a child's behavior, even if you're trying to do a full neurologic exam, bringing them into the clinic can pose problems, because this is not the child's normal environment. They're already they're nervous, they're shy, they withdraw. So seeing them at home, and Amy, you would sort of mention this. Seeing them at home is actually a better thing. You can actually see them in their home environment, which gives you a sort of a better idea. On the other hand, so I guess, how have you altered your intake how have you altered your intake or your exam over telehealth to take advantage of that?
Yeah, I think what I often do is parents will often start kind of trying to keep their kid on their lap for the visit. And so I often will tell people, just put them down and let them play, and take the camera and follow them around. Let them go into whatever space they're at. Some families set up their camera where you can kind of see the whole room. So while you're talking to mom or dad, you can see the child playing in the background. But I often, feel like, trying to get the child to sit on their lap like they would in a clinic visit isn't necessary when you're at home.
Mm-hmm.
And in fact, it gives the child an opportunity to just do their thing, gives parents an opportunity to talk. But I have patients who had not talked to me in the 5 years I've known them, because their anxiety in the clinic was so high that they just would not ever talk to me. And now over the Zoom, I was having conversations where they were telling me about school and telling me about, what was going on in their life. So it has been really helpful, not just for kids with behavioral or developmental issues, but for people with high anxiety.
Mm-hmm. Well, are you afraid of missing something if you do too much telehealth? In other words, sometimes you do the exam and you're seeing them from a genetic perspective, and you look in the ears and, oh, they have an ear infection, or, oh, you picked up something that is not really relevant to the point of the exam. Do you fear?
Yeah, and I think there are things like looking at someone's belly, and is that distended belly just toddler belly, or is there something like a big liver, a big spleen? And there have definitely been patients where we have said, you know what, I really couldn't get a good enough exam. We're going to have to do this again in person.
Mm-hmm.
Or this can be a bridge visit, but we need to come back. And I think the other thing that has been really challenging is getting labs. When people came to clinic, you sent them to the lab. Now you do your visit and you're like, we really need that lab work to know how to adjust your diet.
Mm-hmm.
And people just don't have the same motivation to get to the lab, or don't want to drive the distance to the lab for just a lab visit. And so that also has raised a lot of concern about just timeliness of results that will allow us to change our treatment plan.
Mm-hmm.
Yeah, I think this, we've seen a lot of similar things too, and that's kind of made us, adjust, not like rigid protocols, but like have, a little bit more on a case by case basis, but have an overall protocol in place on how we do like telehealth versus in person. So for example, new patient visits, not all, but most will probably want to do in person first. And then follow-ups, really can be, especially if it's just a results visit, can be telehealth. And then for my, regular rare disease patients that are just following up for their normal follow-ups, I'll, try to do telehealth when possible. But if I haven't seen them in person in a while, maybe if it's been a year, I'd like to make sure I get an in-person visit in. And if the exam is going to be a big part of it, then yes, an in-person visit will be helpful. But if the exam won't be a big part of that, then more telehealth. So we just kind of adapted to depending on what the patient is seeing us for and what we need to kind of accomplish for that visit.
Mm-hmm. Okay, insurance coverage of telehealth visits, supportive or obstructive, or a combination of both? What's your experience?
So far, it's been covered because there have been the kind of state of emergency and those orders have been extended. I think it's definitely a concern that we have. And I have definitely said to patients, if you want this to continue, make your voice heard. Because I think for a lot of families, this is something they don't want to see go away. And we don't want to see go away either. And so I think being able to say this is an important part of our healthcare, we need to make sure this continues at the level it's at, is really important.
Yeah, I agree. We've seen the same so far. It's been not an issue coverage wise, and we're just really, really hoping that continues.
All right, let me describe a horrific scenario. We are experiencing COVID-19. There is a COVID-21 that is being described in East Asia. You have several months because it's going to take time. It's expected to be serious. Knowing what you know now, what would you do differently for yourselves as healthcare providers and for your patients? You have time to prepare. You have this experience.
I think for one thing that I think would be really important is strengthening connections and communication with community facilities like labs. Right now, one of the biggest challenges of having someone get their labs done locally is getting those results back. So I think if we could have time to prepare, having better systems that are starting to happen where you can see the results, whether they're done in your hospital or whether they're done in the hospital down the street, so that patients would have those opportunities, strengthening ability to have in-home lab draws, in-home assessments, and check-ins. I think building a system that could support that would be really helpful.
Brittany, what are you going to do? It's coming.
Yeah. I mean, oh goodness, I just really hope that is not something we actually have to do. But I definitely agree that I think labs have been one of the bigger issues. I think one of the things that I would really like to see is also, obviously there's outside labs too, but even just expansion of draw stations from our hospital, from Yale. Right now we have draw stations for patients outside of the main hospital, but they're kind of more in like the southern Connecticut area. There's not a lot for the northern. So just kind of expanding that, I think, would be really helpful for a lot of patients to have more options. Just with our genetic testing, there are some labs that can't be done at outside labs, so they have to come to a Yale lab. So that can be difficult for a lot of patients if it's far. So labs would definitely be a big one. Maybe just really getting better protocols down for telehealth and making sure that we, in the beginning, I know like getting interpreters was an issue, but we solved that. So just, having all those things prepared so that we have the best, telehealth options for patients and having them all signed up for. So my chart is what they need to be signed up for in order to do telehealth. And that was a thing that, before we weren't doing a lot of virtual, or we weren't doing any, but even, the virtual My Chart messages, we weren't really using those as much. Patients were either calling or emailing us directly. So they didn't have that My Chart set up. So getting all those patients, making sure everyone's set up for that ahead of time also is really helpful to make sure we can just kind of hit the ground running.
I'm going to turn the question back at you, and we'll start with you, Mary Frances. What are you going to do to protect yourselves to support yourselves, to strengthen yourselves?
Well, first I'll answer the first question. My first answer to the previous question, I'm a little bit older than the other girls here. I was going to say retire. But I think in all seriousness now, in answer to this question, I think I would get licensed in other states. I'm only licensed in Massachusetts right now, so I would get multi-state licensure. I would send an email to some of my classmates from Sarah Lawrence and say, you know, this is like a long haul way that we're practicing and providing care. I'd like to propose, you know, we have a monthly call, who's in, you know, to stay in touch, to run cases by each other and things like that, just to have that sort of as a framework.
How are you going to protect yourselves, Brittany, Amy?
I mean, I'd probably also make sure that I am allowing myself more time on self-care things. I think one of the things that as providers we need to be reminded of is that you really, it's really true. Like, you can't pour from an empty cup. So, I mean, if you are being run into the ground, you know, you can't be the best for your patients. So just, you know, making sure that I am also giving I'm not always good at that. I'm always kind of been a person that's like, go, go, go. So just making sure I take a minute to slow down a little more, and, you know, taking some time for myself too, I think would be something that would be helpful.
Yeah, I agree. I think boundaries got very blurry during the pandemic because you were working from home. So you could start at 7 a.m. and you could go till 7 a.m. or you know, check that email one more time, respond to that one more thing, which we were doing before the pandemic. But I think because your office space was in your living room, it just became very easy. And I think more expected. And I think setting those boundaries and saying it's the weekend, it's 5 o'clock or 6 o'clock, I'm turning this off, would be something I would want to do. And then I think trying to, like Brittany said, have protocols in place, have things that we could share with patients ahead of time. Hey, if we have to switch back to a all telehealth model, here's the steps we're going to do. This is what would be helpful. This is, you know, kind of, this is the schedule you've been on, and this is how we're going to keep you on this schedule. So just that ability to kind of see it coming would have been helpful.
All right. Okay, so it's time to wind down the session. I want to thank you, speakers. Thank you for sharing your experiences. Thank you for sharing your fears, your plans, and I wish you all strength. And let's hope there is no such thing as COVID-21 or 22 or 23. All right, so I'm going to close this session, but just a reminder for you folks out there, remember the raffles are up until the afternoon break. So pay attention to that. Keep watching, because for the gaming project, so we're watching who is participating. Visit our exhibitor hall, and don't forget to fill out the conference evaluation. Just a word, Jeff, I believe I have to leave in order to come in again on a different link. So I will see you all very shortly. Thank you all.
Thank you, everyone.
Thank
Bye.
you.
Thank you.